2004, nurse leaders representing 23 organizations began working together over a 4-year period to develop new national standards for advanced practice registered nurses. These standards, when adopted by each state, will ensure that the education, accreditation, certification, licensure, and practice requirements for advanced practice registered nurses are the same throughout the country. This will increase mobility of advanced practice registered nurses and allow them to move to other states without having to meet different licensure requirements. And most significant, the new changes outlined in the consensus model ensure public safety by making certain that an APRN in one state is equivalent to APRNs in every other state.
We're responsible for the whole care of the patient, so we have to have all the skills to be able to do that. And so we have graduate level education.
A high level of education is needed to be an advanced practice registered nurse. That's why the new national standards outlined in the consensus model require that, regardless of role, APRN education be at the graduate level.
Graduate student, regardless of whether they were a nurse practitioner, clinical nurse specialist, midwife, or nurse anesthetist, would be able to go into an auditorium and all learn together these three, what we call the 3 Ps. They're broad, general courses on pharmacology, physical assessment, and pathophysiology. They would also have seminar courses and didactic courses before they ever began their minimum 500 hours of clinical practice in a setting where they would be delivering one-to-one direct patient care.
To ensure that every program preparing students to be advanced practice registered nurses meets specific requirements and program essentials, the new national standards require that each educational program be accredited by one of the major nursing accrediting bodies.
As part of the new advanced practice model that we're all looking at, the consensus model, accreditation has a very important role because accreditation will do pre-approval of the program so that any program that begins will use that model to guide the development of the curriculum, the competencies that are used, and so on and so forth. Our goal in all of this process is to assure safe and competent people to practice.
The benefit of the APRN consensus model is the enforcement of the congruence of the educational preparation to the certification exam. Certification renewal is actually a perfect example of how the public will know they have a competent individual managing their care. Certification is time limited. It can range from 3 to 5 years. Before that certification can be renewed, the individual must provide evidence of having met specific criteria.
There are lots of things that we are trained to do, competent to do, have experience doing, which we may not be able to do. The states then designate rules about how we can practice in that state, and that does vary from state to state.
Licensure is the next step required for practice as an advanced practice registered nurse. This is in addition to the RN license. Oversight of licensure and practice of advanced practice registered nurses is through the State Board of Nursing.
Boards of nursing are the most appropriate bodies to oversee the regulation of advanced practice registered nurses because they are the bodies that are composed of members of the profession. They are the people who know the standards of the profession, the educational requirements, the scope of practice, and so on. The consensus model has a number of benefits. It will benefit the public in that it will increase access to qualified healthcare professionals. It'll benefit the advanced practice nurse who doesn't have to meet different requirements for different states. Advanced practice nurses have the same knowledge and skills regardless of what state they're in, and there's no reason for them to meet different requirements in order to practice within their scope of practice.
The advanced practice license will be specific for each role. For example, nurse practitioners will receive a license that indicate that they are nurse practitioners. Nurse midwives' licenses will indicate that they are midwives. In addition, the license will also specify what population of patients the advanced practice registered nurse is qualified to care for, whether it be neonatal, pediatric, adult, the family, women's health, or psych mental health populations.
Every state has different laws and requirements for advanced practice registered nurses. By adopting the new requirements outlined in the consensus model, your state will be assuring consumers that advanced practice registered nurses are highly prepared and ready to provide safe care. In addition, they will be supporting a model that will allow for greater mobility and access to care to more people across the country.
Support the new requirements in the consensus model for advanced practice registered nurses. For more information, go to the National Council of State Boards of Nursing website at www.ncsbn.org.